Assalamualaikum everyone. I hope you all are doing great. Ramadan Kareem. So this is Lara Samhan, and inshallah today we're gonna have the Endocrine OSCE review. So let's get started. Okay, so for the objectives of today's session, inshallah, we're gonna start off with solving some important OSCE questions. They're almost similar to the questions that come in the OSCE, and then we're gonna go all the way to review the whole endocrine anatomy and histology, like OSCE pictures, images, and like everything, inshallah. So we're gonna start off with the important things, which are the questions, to have an idea how the OSCE of the endocrine generally comes, and then inshallah we can go through the one by one the histology and the anatomy and everything else. So let's start off with our very first questions. So let's make this session a bit you guys can answer in the chat box, and then inshallah I'm going to tell you if the answer is correct or not, and we're going to discuss it inshallah all together. So in regards to our very first question, so we have in this picture and this picture, this histo picture. So this gross picture and this histo picture. So the question asks, what is this structure? Which is basically this thing in here, the histology picture. So what do you guys think is this thing? Any guesses? Okay. Tamam. Okay, so basically this is called the hearing body. So this hearing body is available all the way in the pituitary gland, in the posterior pituitary gland, and this hearing body, it actually produces two hormones. So what does the posterior pituitary gland produce? We have two hormones. So those two hormones are produced by those hearing body. So if we want to zoom this posterior pituitary gland, we're going to see this histology pictures, and we can see those things which are the hearing body. So what are the two hormones that the hearing body or that the posterior pituitary gland produces? Number one is the ADH, exactly, and the second one is the oxytocin. Yes, exactly. So in the first question, it says, what's this structure? As you kindly said, it is the hearing body, and the hormones that are released from it is the ADH and the oxytocin. So this is how it's almost very similar to an OSCE question that actually comes in the exam. Well, yeah, it can basically look more pink, but generally speaking, like this is how it looks, generally looks like, tamam. Okay, perfect. And for example, if you aren't sure what's this image exactly, you can look at the gross image if a gross image is provided, so you'll have an idea. Okay, so we're pointing to the pituitary gland. That means it's maybe something related to hearing body. So like if one image isn't really so clear to you, if you have another image, like a supportive image, this would like make it clearer for you, like to exactly know what's the answer. Okay, and inshallah throughout the session we're gonna like say some tips and tricks of, for example, how to get the closest or the most correct answer, even though you aren't like 100% sure of it. Okay. So this is the first thing. The first step is that if you aren't sure of this picture, just look at any other picture if it was provided, so that you will be oriented where exactly this histological picture can be taken from the body. In this case, if we have this picture, خلاص, we're gonna know and it's in the pituitary gland. That means most probably it will be a hearing body. Tamam? Okay, perfect. Moving to the next question. It says here, what is structure A and structure B? So we can see this is a gross image, okay, and this is also a gross image. So this is structure A and this is structure B. So what do you guys think is this? Okay, so this is a fallopian tube, exactly, and this is the structure B is the vas deferens, exactly. So structure B, I'll just zoom in a little bit so that's going to be clear. As you can see in this thing is basically the vas deferens. So a question can come very straight to the point like this thing. So what is structure A? What's structure B? Good. Now, what are the type of cells that are available in structure A? So what type of cells? So we said this is the fallopian tube. What does the fallopian tube has? Like, what's the name of the cells in the fallopian tube? So we might know that the fallopian tube is a tube. Exactly. Type. So it should have ciliated cells, right? For the ovum to be moving all the way from here, all the way till here in the fallopian tube. So it should have cells that are ciliated. So خلاص, we know that it should have ciliated cells. What type of ciliated cells do you guys think it should be? Columnar ciliated cells, exactly, and we have non-ciliated cuboidal, and most of the times the ciliated cells are almost always with the columnar cells. So it's gonna be, so the fallopian tube is gonna have the columnar ciliated cells and non-ciliated cuboidal cells. So those are the cells that are available in the fallopian tube. So خلاص, by this we know what is the structure and what are the cells available in this structure. Okay, so moving on, those are the answers as you correctly kindly said. We have the herring body, ADH, oxytocin, fallopian tube, vas deferens, and the columnar ciliated cells, and the non-ciliated cuboidal cells. Okay, so moving on to the next question. Identify in this sagittal section, this one in here, structure A and structure B. So I'll just zoom in. What do you guys think structure A is pointing to? Perfect, exactly. So structure A is pointing to the testis, excellent. And structure B is pointing to this thing in here, this thing and this thing, the two lobules, excellent, which is the prostate. Yes, exactly. So in here we have the testis, and here we have the prostate. Perfect. Type. Moving on to the next question, it says identify structure A, which is this thing. Let's zoom in. What do you guys think are those plexuses? The pampiniform, exactly, it's correct. We can also say, since we want like the name of the plexus, is the pampiniform plexus. Tamam. Okay, perfect. Moving on to the next question. So identify in this sagittal section structure A and structure B. What do you guys think is structure A? This one in here. And structure B, like the whole thing, this one. So what's structure A? So it is the ovary, exactly. And structure B is the whole thing, which is the uterus. Tamam? Perfect. Moving on to the next question, it says identify structure A, like what does it cause? If you have any injury to structure A, which is this thing in here, this thing. So if you have, what is the name of this nerve? This nerve? The recurrent laryngeal nerve. Yes, exactly. So we have in here the recurrent laryngeal nerve. Let's get oriented to this picture. As we can see here, this is the trachea, and this is the bronchi. This is the bronchi, the right and the left bronchus. Here we have the major vessels. We have the aorta. We have the pulmonary artery. Okay, so we have in here a nerve that appears. And here we have, this is the ligament, the patent ductus arteriosus, which then closes to the and becomes ligamentum arteriosum. And here we have a nerve that comes pass through it. So this nerve, as we said, is called the recurrent laryngeal nerve. So خلاص, also in the OSCE, once you see a gross image, if you don't really know what's this nerve or what's this structure, just get oriented to the whole structure in general. Like, where are you exactly? Where are you in the space? So once you know, okay, خلاص, this is the trachea, this is the bronchi, خلاص, you know most probably the structure is somewhere in the upper chest. So by this, خلاص, once you're oriented, no matter what answer you're gonna answer, if you aren't sure, it may like be inshallah correct عشان خلاص يعني you're oriented exactly where you are in the body. تمام? So as we said, this is the recurrent laryngeal nerve. If we have any injury to the recurrent laryngeal nerve, because it supplies or it innervates the vocal cords, so the patient will actually present with hoarseness of the voice. So once we have a patient who presents with hoarseness of the voice, we might predict that there is an injury to the recurrent laryngeal nerve. Okay, so if we have an injury to structure A, which is, we should first know that it's the recurrent laryngeal nerve, to know that if we have injury to it, hoarseness of the voice will be produced. Tamam? Okay, perfect. And those are the answers as you correctly said. So moving on to the next question, it says, which joints are responsible for increasing during the labor? As we know, during the labor, the baby passes through the birth canal, which is through the pelvic or the pelvic bone, the pelvic brim. Tamam? So what are the things that help in increasing the labor? God subhanahu wa ta'ala just created the female pelvis in a way for it to be wider, for it to be round in shape compared to the male pelvis, which is longer and narrower. So having this orientation of the female pelvis helps in the baby to be all the way passing through the birth canal. Okay, so as you correctly said, the things that help in increasing the labor is number one, the sacroiliac joint. Okay. And also we have the pubic symphysis in here. So once the birth process is gonna happen and the female is in labor, we're gonna have a thing that will help in, for example, widening the pelvis and help in the labor process is the sacroiliac joint. Here is the sacrum, this is the sacrum, and this is the iliac bone, So the sacroiliac joint, number one, and number two is the pubic symphysis. So those two things or those two joints will help in widening and help in having all the way baby passing through the birth canal. Okay, perfect. So this is the correct answer. Right. Now, since we get oriented to how the questions in the exam are going to be asked, it's going to basically almost be similar to what is asked from above. And the most important thing, to be honest, is that to be oriented to the structure, like whatever structure is in front of you, especially if, like, for example, they get you a direct structure or an image, it would make it a bit sometimes easier than like a question without image. So if you don't know where is this image exactly, or you forget what structure it is, just get oriented. What is this image about? For example, for this image. So خلاص, you get oriented that this is, for example, the male reproductive system. Then the answer is going to be maybe something in related to it. سواء related to the anatomy, even if they get histological pictures, something related to the histology. So خلاص, once you're oriented to the whole image, inshallah, most probably you'll get the answer correct in terms of like the things they ask. So let's move one by one. So this is the male reproductive system. We have in here, just to get oriented. So this is a sagittal image. We have from back, we have this is the colon. Here we have the urinary bladder. And then after that, immediately we have the prostate. We have in here the urethra. And we have in here the testis. We have the prostate, as we said in here. We have in here the epididymis. And we have all the way in here the vas deferens. Okay, well, now we get oriented to the general anatomy of the male reproductive system. Now moving on to the histological image, it basically just gets a cross-section of the testis, as we can see in here. This thing, the testis in here, is just all the way zoomed out, and it looks like this, okay? So in the testis, as we can see, those structures, which is the yellow in color, is basically the seminiferous tubules. So they got actually a couple of histological images of the seminiferous tubules, as we can see here, number 1, number 2, and number 3. So for the first image of the seminiferous tubule here, they got a cross-section from here, and then they zoomed into here. For this image, they got a cross-section from the vas deferens, and this is the image. For the rest of the seminiferous tubule, they all the way zoomed into here. So as we can see, we have different histological images, okay? So let's get more oriented to it. So if we got a cross-section of the seminiferous tubules, as we can see here, it looks like this. And as we know, we have the cells in the seminiferous tubule, which are the Leydig cell and the Sertoli cell. And as I explained in my previous session, is that the testosterone is produced by the Leydig cell, okay? So it's very important to know that testosterone is produced by the Leydig cell, which is available in the seminiferous tubule. So if they got an image like this, we know that here we have the Leydig cell, we have the Sertoli cell, and those two cells are available in the testis. Like, now moving on to the another cross-section, as we can see in here, all the way from this cross-section in here, we can see in here the spermatozoa, and as we know, the testis has those Leydig cell and the Sertoli cells that have the Leydig cell in the production of the testosterone, and all of these things work all the way together to have the sperm production, okay? So we should actually normally see the sperms and the spermatozoa and like all the spermatogenesis process that happens in the testis. So as we can see in here, the spermatozoa, I'll just zoom in more. This is how it looks like. We have over here the cilia or the stereocilia. We have in here the pseudosolidified columnar epithelium. And as we said, usually the cilia is associated with the columnar cell. And here we have those like spaces are basically the smooth muscle that help in like the ejection of the sperm. Okay, now in regard to this cross section, which is available in the vas deferens, this is how it looks like. So starting from this side, as you can see here, this is the lumen, okay, where the sperm is going to be actually available. Here we have to zoom in more. We have in here the epithelium. We have in here the muscular layer, the inner muscular layer, and the outer muscular layer. And also we have the middle muscular layer. And lastly, from the very outside, we have the adventitia. Okay, so this is how it looks like from inside all the way to the outside. Okay, so this is just to explain more about the histological images. And usually, if you wanna like an easy way to read a histological image instead of just looking at pinkish or purplish or whatever color, try to start either from out to inside or from inside to outside, so that you get oriented where you are exactly. For example, if you're gonna start from inside to outside, خلاص, you're gonna know that this is the lumen. Here you have epithelium. Most probably here we're gonna have muscular layers, and the very outside in most of the cases is adventitia. So خلاص, once you know where you are exactly, if you guessed whatever answer, and inshallah it's gonna be like very close to the correct or even correct. Okay. So moving on to explain just more about this thing, we're just comparing in here the seminiferous tubule and the epididymis. As we said, either start reading the histological picture from inside to outside or outside to inside. So as we can see here, we have this whole circle, and then we have an empty space in the middle, which is the lumen. After that, we have the epithelium, and then we're going to usually have the muscular layer or adventitia. So in regard to this image, we have in here the lumen, here we have the epithelium, And here we have the, as we said, the Leydig cell, which produces the testosterone hormone. Here we have some of the spermatozoa that are all the way in the process of maturing. Okay. And then we're going to have, once they are mature, they will all the way go to the lumen as sperm, and then they're going to all the way like be ejaculated once needed. Okay. So here we have another image of the seminal vestibule. We have in here the, we're just repeating everything. So basically in the upper image, we have the seminal vestibule, how it looks like, starting from inside to outside or outside to inside. And then in the second image, we have the epididymis. So as we said in here, in the lumen, we have the spermatozoa. We have after that the epithelium or the columnar epithelium. And then those epithelium have the cilia, which is the stereocilia, and all the way from outside, we have the muscular layer or the smooth muscle. Okay, so moving on, since we just explained briefly about the histology and everything, now we're going to move on to the pituitary gland. And I basically mixed the slides of the endocrine and reproductive slides so that it will be like more of not being like quite boring. Okay, so once they get, for example, this image, they can tell you, they can point in any structure and tell you what is this structure. For example, in this case, I just pointed the arrow onto this structure. So what do you guys think is this structure? I mean, the answer is in front of you. It's for the sake of just making it a bit interactive. Exactly. So it's the pituitary gland. Perfect. So once we have this image, as we said, if we're going to zoom in all the way to this structure, we might not really know it directly, especially with exam or stress or كده, يعني we might not really get oriented immediately. So once you zoom out and look to the whole structure, خلاص, we're going to know that we are in the head. This is the brain. This is the cerebellum. Here we have the nasal sinuses. Okay, this is the nose. Here we have the eye. Okay, so once you know, once you're oriented, this is somewhere in the head. Okay, you will know that since we're endocrine, and then this is most probably the endocrine gland, which is the pituitary gland. Okay, so as we can see here, number 11, as you kindly said, is the pituitary gland. We have this is basically the one that holds the pituitary gland. Is the pituitary stalk. In front of it immediately is the optic chiasm, and in front or above the pituitary stalk is basically the hypothalamus. So usually we have the hypothalamus, and then immediately under the hypothalamus we have the pituitary gland. Okay, so like those are the most important things. We might have other namings, for example, like the sphenoid ear sinus, the sella turcica. We have like many things. You can read these things. Of course, it's not, and it's quite important, but for the sake of the exam, let's try to focus more on what we predict, like the questions are going to come. And of course, since it's endo repro, it will come more to endocrine and like repro questions. Okay, so moving into the next question, it's exactly the same thing, but we should get oriented where we are exactly in space. So we can see here, this is the skull. So خلاص, let's look at the general picture. The general picture is that we're in the skull. خلاص ممتاز. Then they most probably will ask something related to the head, not something related to, for example, the reproductive organs. Okay, so this is the same exact thing. We can see this is the head, this is the skull, and this is basically like a sagittal section. So we can see in here the same exact thing, but in another angle. This is the anterior of the head, and this is the posterior. How will we know anterior and posterior? We can see the cerebellum is here. So this is the back of the head. Okay. So once we're oriented into space, where we are exactly, we will know, inshallah, that, for example, what is this? This is we will know and we will be sure of what we're saying. So, for example, this is the pituitary gland. We have in here the stalk. In front of it is the optic chiasm, and above, which is above the pituitary gland, is immediately the hypothalamus. Okay. Okay, perfect. So moving on. So now we're going to talk more on the thyroid gland. The same exact thing. Let's get oriented to the whole image. So this image, as we can see, this is the end of the head or the mandible, and this is the beginning of the neck. Same goes to this section. This is from the side. Okay, so we can see the exact same thing. So they want something. They will point on something from the neck on both images. So both images are almost the same, except for it being from different angles. So we have in here, as we can see, since it's endocrine, reproendocrine, so they will ask about an endocrine organ. They won't ask about what's the name of this bone or whatever. So they will ask about the endocrine organ. And once you know, خلاص, we're in the repro block, that means our answer should be something related to what we heard or what we took. عشان not to answer something like very out of the box, just to at least have a very approximate answer to the correct answer. So we can see in here, this is the thyroid gland. Okay, so the thyroid gland is available in the neck. So it has a couple of lobes we have in here. This is the thyroid gland, like this, like this. So we have in here, this is the right side. So like the patient is always, or this like model is always opposite to us. So this is the right side. So this is the right lobe of the thyroid gland. If we have right side, that means we should also have the left side or the left lobe of the thyroid gland. تمام. The thyroid gland from above, it has a pyramid. So this is the pyramidal lobe, number 3. And the thing that connects everything all together is the isthmus. So where exactly is the thyroid gland attached to? It's attached all the way to this structure, which is known as the trachea. Okay. This is because this is why, for example, if we have any enlarged or goiter of the thyroid gland, it might affect the voice and change in the voice because it's going to affect the vocal cords immediately that are available in the larynx. Okay, so this is like one extra thing to add. And of course, behind the trachea, we immediately have the esophagus. We can see it in this section more clear. So as you can see here, this is basically the left lobe of the thyroid gland. And you can see in here, it's immediately attached to the trachea, which is number 5. And behind the trachea, we have the esophagus, okay? And in the trachea, we have the tracheal rings, okay? So those tracheal rings are basically circular in shape. Why are they not complete, like for example, circle? They are instead like half circle because behind the trachea, we immediately have the esophagus. So in the esophagus, we have the food passing all the way. So if this trachea has a complete circle and we have a large bolus of food, the food won't be able to all the way compensate and move easily throughout like its passage in the esophagus because the trachea will be a whole circle. This is why SubhanAllah God created the trachea to have a half circle so that whenever the esophagus have a big bolus of food, it can all the way compensate itself and push throughout this empty half space of the trachea because it has a half circle and all the way be easily like swollen. Okay, to easily swallow it. So this is also extra thing to add. Okay, perfect. So we have, this is the exact, almost same image. Let's get oriented to it. So as we can see here, this is the whole image. We can see here there's teeth. Okay, so we are talking something, this is the mandible. So this is the beginning of the neck. So we're oriented that this structure is something related to the neck structure. صح? طيب. Now, since we're oriented to where are we exactly in the space, now we can know and we are sure that, for example, this is the thyroid gland. And the thyroid gland is actually very, very, very vascular gland. And like if there's an injury to the arteries while doing, for example, thyroidectomy or anything, it could really bleed so hard. Okay, so let's get oriented more to what's exactly here. Yeah. So we have in regards to number 11. What's number 11? As we said before, this is the thyroid gland, and this is just a side section, or this is just the image of the model from the side. So this is the right side of the thyroid gland. Mumtaz. As we said, number 12 is going to be the isthmus, which is going to basically connect the right and the left lobe of the thyroid gland. Because we know it's number 11, we know it's number 12. As we said, behind below the trachea is the tracheal, it's behind the thyroid gland is the trachea. And as we can see here, those are the tracheal rings, which are basically cartilage. And then we have here this nerve is basically the recurrent laryngeal nerve. So this is the recurrent laryngeal nerve. This is the thyroid gland. What about this artery? This artery, since it's going to supply the thyroid gland, so it's going to be the same name. So this is the superior. Number 10 is the superior thyroid artery. The superior thyroid artery will all the way supply the thyroid gland. Tamam. And then here we have a muscle which is called the thyrohyoid muscle. Why is it called thyrohyoid? Because it's attached to the thyroid gland and the hyoid bone, as we can see all the way in here. Tamam. Okay. Yes, exactly. So we have in here the this artery, as we said, which is the superior thyroid artery. Perfect. So number 17 is basically the thyroid cartilage. So it makes sense. So since we're talking about the thyroid gland, we're talking about this cartilage. So this cartilage will be something related to the thyroid, which is the thyroid cartilage. Okay. So the thyroid cartilage is located above the thyroid gland. Okay. Perfect. And this is the hyoid bone. So now we're oriented to everything in here. So whatever image, whatever angle they got us, this image, we're gonna know exactly where are we oriented. Okay. So moving on to the next image, as we can see in here, where is this image exactly? We can see, and here this is the beginning of the shoulder, this is the neck, and this is the end of the face. So, or the lower part of the face. So they most probably point in something in relation to something in here. صح. Yeah, let's get more oriented. So as you said, what is this? This is the thyroid cartilage. صح. And as you can see in here, this is the thyroid gland. So this is the thyroid cartilage, and this is the thyroid gland. Okay. Yeah, let's get oriented more to the blood vessels سواء artery أو حتى vein. So we can see in here this letter E. It's basically the pituitary vein. صح. We can see this pituitary vein. We can see this branch, which is letter D, is the internal jugular vein that will all the way go up into the head and supply with everything that's available in the head. We can see in here the K. K is basically the aorta. As you can see in here, the aorta is going to come like this, and this is the aorta, or to be more specific, the arch of the aorta. So the aorta will all the way also split, and one of the splits that will give is basically letter A, which is the common carotid artery. So this common carotid artery will further all the way split more and more, forming the external and the internal carotid artery. So as you can see here in letter B, we have the external carotid artery that will all the way go external to the face. Internal carotid artery will go to the inside of the head, or of the of the head in general. So external will supply the external things of the head. Internally will go all the way internal to the head itself. Okay. So we know already what is letter A, E, K, D. Type. What about letter C? As we said previously, we have in here, this is a thyroid gland. So this will be an artery in relation to thyroid gland. What is it called? It's called the superior thyroid artery. So we can see in here the superior thyroid artery comes from the external carotid artery, and the external carotid artery comes all the way from the common carotid artery, and the common carotid artery comes from the aorta, or the arch of the aorta. Okay, please. Okay, perfect. So moving into this structure, where is this structure exactly in space? So as we can see in here, those are the kidneys. Nothing in relation to the kidney for enterogram, right? Right. So it's most probably going to add something in regard to the vessels. As we can see here, this is the vein and this is the artery. Tamam. So let's just get oriented to the whole thing. Like number one, we have in here as I said, this is the kidney and this is the kidney. What's all the way above the kidney is the adrenal gland. So we have the right and the left adrenal gland. صح. Perfect. Now let's get more oriented to those things. So we have letter D is going to be a vein, which is called the inferior vena cava, right? Right. And then letter E is an artery. So what is it called? It's called the abdominal aorta. So we have the vein and the artery. Right. Now we have letter B, which is the inferior vena cava, will give us the right and the left branches. What is the right branch that it will give us? The inferior vena cava. For the kidney or for the renal, it's basically called the right renal vein. What about letter G? Letter G is the left renal vein. So if we have the right, we will always have the left side. So both of them are the renal vein. تمام. So as we said, this is the abdominal aorta. تمام. Letter E. And what else do we need to know? So this basically this letter E, which is the abdominal aorta, it gives many branches. One of which we have in here the letter C is basically the celiac trunk, and we have in here letter D is basically the superior mesenteric artery that will supply the GI tract. Okay, so this is it in regard to this image. So moving on to the next image, it's almost exactly the same exact thing. Let's get oriented in the space where what are those things. As you can see, this is the kidney. Above the kidney is the gland, which is the adrenal gland. We can see in here the vein and the artery. This is the inferior vena cava, and this is the abdominal aorta that all the way gives supply to the right and the left kidney. Tamam. So moving on. So what is this? This is the pelvis. What does the pelvis have? It has a couple of bones attached all the way together. So as you can see in here, this is the sacrum. At the end, we have over here the coccyx. We have in here, this is the ilium. And then we have in here, this yellow thing is basically the pubic symphysis that connects both of the pelvic bones all the way together. What else we have in here? This is the ischium, right and left. We have this green thing is basically the pubis. So those are all the structures that basically form the pelvic bone. So we have in here the exact same thing. We have in here the true pelvis, the pelvic brim. Pelvic brim is basically this brim. Okay, and as we said, the difference between the male and the female pelvis is that the female pelvis is wider and compared to the male pelvis, which is longer. Okay, and why do we have differences in the female and the male pelvis? Is that because the female during carrying the baby and during labor, it will all the way facilitate an easier labor of the baby. Okay, so moving on to the next thing, we have in here the pelvic X-ray of the pelvis, as you can see clearly in here, and it basically just pinpoints everything in the pelvic X-ray. So we have in here, what do you guys think? Is this a male or a female pelvis? This thing. So as you can see, this pelvis is quite long, right? So is the longer pelvis more to female or male? Exactly, this is a male pelvis, exactly. As we can see in here, the pelvis look longer. It looks from here narrower. The pelvic brim is narrower. So this is most probably a male pelvis. Okay. Plus, in regard to this thing, that if we have an image that shows the toxic one, it won't be all the way going outside. No, it will be pointing inward, which makes it the pelvic brim and everything is going to be way narrower. Okay. Perfect. So this is in regard to the male pelvis. Now moving on to the female pelvis. As you can see, guys, I'll just zoom out for it to be clearer. So this is, as you kindly said, the male, and this is the female. Look, in regards to the diameter, the male is wide, narrower than the female. The female is really so wide. Okay, so the male is quite narrower than the female pelvis, which is really super wide. This is the first thing. Okay, the second thing, as you can see in here, it's not really long, right? So in the male, it's quite longer than the female. In the female, it's not really quite long compared to the male. Like those are the main differences, and you have way many more other differences. Okay, so perfect. So moving on to this structure. So this structure is quite zoomed in, right? Right. So let's get oriented. Where exactly is this structure? So as you can see in here, this is the bone, which is known as the sacrum, and then we have in here the coccyx or the coccygeal bone. Okay, so we know right now that we are in the pelvis. So whatever structure they will pinpoint to will be a structure in regards to the pelvis. So we have a number one, as I said, this is the coccyx bone, and we have here number two is the sacral bone. Like, what else do we want to know from all those structures? So we want to get oriented. Those everything, as you can see in here, are muscles. Tamam. In regards to number 19, as we said, this is going to be the rectum. If this is going to be the rectum, all other structures like the genitalia structures are going to be in front of it. You can see in here the vagina, and it's going to be the urethra. Okay, so this is a female pelvis. Tamam, tamam. So we have in here a couple of other structures pointing to the artery, different arteries, different muscles. So let's get oriented more. Like, so let's get to know more about number 21. So number 21 is pointing to a vessel, right? So once we know, for example, 21 is pointing to a vessel. Once we know this is a vessel, our answer is going to be something in related to vessel, not something, for example, in related to a muscle or to a bone. Okay. So what do you think is number 21? Blind guesses. So number 21 is the iliac vessel, okay, or a common iliac vessel. This is in regard to number 21, both of them, okay? And then this iliac vessels will all the way give their branches all the way to support the pelvic muscles, okay? So we have in here the different arteries. Okay. For example, we have in here number 12 is basically the lateral sacral artery. Why is it called sacral artery? Because it's available somewhere beside the sacral bone, okay? What else we should know in here? We have, for example, number 16 is pointing to another vessel. Same goes to number 22, 9, 11, and everything, okay? And generally speaking, in the exam, once you get oriented to where is this exactly, like where are you exactly pointing to, plus if you know what are the like major vessels and what are the most important arteries plus nerves that may have like pathology in regards to it, those are like the most high yield questions that may come. Other than that, you know, they don't really most of the time go to low yielded arteries plus veins plus nerves to be asked. Okay, so let's get more oriented. So basically we have in here number 15 is the pudendal artery. So once you hear the word pudendal artery or internal pudendal artery, it's somewhere in the pelvic floor. What So we have, for example, number 3 is the piriformis. They want me to ask what is this piriformis? It's quite a low yielded question. Okay. So number 15, as we said, it is the internal pudendal artery. Okay. So number 15 is this is number 15. I'll just do any more to be clear. This is the internal pudendal artery. تمام. Okay, perfect. Any other questions? Okay, perfect. You're most welcome. Now, moving on to the next image. So it's almost the same. I'll just zoom out for it to be clear. Right. So as you can see in here, this is the posterior part. Why was it the posterior? We can see the vertebral bones all the way from here. And this is the anterior part. Tamam, tamam. So we can see in here this structure. What do you think is this structure? It's at the very posterior. So this is the rectum. Excellent. Exactly. So this is the rectum. So now first we are oriented that this is, for example, a surgical picture of the pelvic floor or of the lower parts of the abdomen and the lower part of the vertebra. Okay. So once we are oriented to where is this exactly, so you will inshallah most probably answer the correct answer. So as you said, this is the posterior part and this is the anterior part. So if you said this is the rectum, this thing, what is it going to be? That connects the both pelvis together, pelvic bones together. It's the it's the pubic symphysis, exactly. And in female, it helps. It's one of the joints that actually help in the labor. Okay, so as you can see in here, all those pinkish colors are basically the muscles, different muscles all the way in the pelvic floor. This muscle is basically the puborectalis. This muscle number 5 is the pubicoccydus. This muscle is the iliococcygeus. Okay, so we have those are the muscles of the pelvic floor. Okay, so here the exact same thing. It's also pointing to different veins, different arteries, and different nerves as well. So as we can see in number 10, it's basically a couple of nerves. Okay, so you can just get oriented. The red is the, as you already know, is the artery. Blue is the vein, and this whitish color or the yellowish color is the nerve. Okay, so what is this? For example, if they ask about this and you don't know, if you just wrote nerve, it would be way better than just writing artery. So this is basically a nerve that comes from where? From the sacral bone. So it will be a nerve in regards to the sacral bone. So it's called as the sacral nerve or the sacral, since the plexus of nerve, sacral plexus or the sacral plexus nerves. Okay, so this is an easy way to get the correct answer. Like one of the tips and tricks to get the correct answer, even though if you aren't really 100% sure. Okay. No, perfect. So we have in here this muscle, as I said previously, it's the piriformis muscle. We have in here the arteries and the veins. The number 12 is the lateral sacral artery. We have also number 13 is the inferior gluteal artery. As you can see, it's going all the way to the gluteus muscle. So it's all the way coming like this from inside to the gluteus muscle. What else? So we also have the umbilical artery. As you can see in here, so if there's an abdomen in here, it's gonna go all the way to the umbilicus. Okay, so this is like mainly it. As we said, in regard to this thing, I know this seems quite a lot, but as I told you before, just go to the thing that's high yield. How will we know this is high yield? To the for example, vein, artery, muscle, nerve can easily have a pathology in it. That's like the doctors quite repeat it. So like at least to like try as much as possible to like remember like and memorize like the most important things. Okay. So moving on to this cadaveric image. As we can see, first we should get oriented. Where is this? So we can predict this is somewhere, maybe in the abdomen, right? Because how will we know this thing? We can see the split of the artery. What's the name of this artery? The abdominal aorta, right? So this artery splits at the end of the abdomen, so that it's going to go all the way to the right and the left leg. Okay, so خلاص. Now once we're oriented where exactly we are in space, inshallah we're going to get the answer hopefully correct. So as we said, this is the artery, and beside the artery we almost always have a vein. So this is the abdominal aorta. Okay, beside the abdominal aorta we have the inferior vena cava. So خلاص, we know this is an aorta or an artery, and this is a vein. So this abdominal aorta will split all the way into two things, which are the common iliac artery. This common iliac artery will further split into the external and internal. If we have anything external, we should definitely have something internal. So this is the external iliac, and this is the internal iliac on both sides, the left and the right side. Okay. So moving on to this thing, it's almost the exact same image. This is the abdominal aorta, and this is the inferior vena cava. Here it's just focusing on other branches of the nerves. So I know this might be a bit confusing because we have a lot of nerves, and they are almost very many and very, very approximate and very close to one another. But let's try to memorize like the most important. Okay, so for example, in here we have the obturator nerve. Number 1. Number 2, we have in here the genitofemoral. So from the word it says genitofemoral, it means it will go to the genitalia and the femoral, which is femoral part. Okay, so because of that, it's called the genitofemoral. We have in here this bigger nerve, it's called the femoral nerve. This thing is the lateral femoral cutaneous. So lateral femoral cutaneous, how will you know it? As you can see, it's going more to superficial because from the word itself, it says cutaneous. So cutaneous is like the skin. So it won't really go deep as other nerves like are going. So it will go all the way superficial. So it's lateral because as we can see, it's going to the lateral side, not the medial side. Femoral, it's more going to the femoral, like the part of the leg or the thigh. And the cutaneous because it's going all the way to supply also the skin. So this is why we call it lateral cutaneous nerve. So as we know, it's going all the way up, which means it's lateral cutaneous nerve. If you know, for example, what's this? If they pointed to anything else, this or this or this, we might know, we might get more oriented to it instead of just memorizing this is blah 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 blah. Okay, perfect. So we have this very mini thing is the area inguinal nerve. So from the word itself, it says iliac. So we're gonna go to the iliac place and the inguinal like structures. Okay, we have in here the iliohypogastric nerve, and we have in here the subcostal. So subcostal, why? Because it's like behind the ribs, behind the costal ribs. Okay, so now we get oriented. Why are they basically named the way they are named? Okay, this just makes it easier to memorize them. Come on. So moving on to the next thing, we have in here the female reproductive system. So as you can see, this is basically an anatomage. Okay, so how will we know, for example, that this anatomage is the female reproductive system? So as you can, just to get oriented into the space, we can see here, this is a sagittal section of a lot of structures. Let's get more to below. So as you can see here, this is getting a cross section, like a sagittal section of the lower part. We can see in here, this thing is the uterus. Okay, so, and you can see this thing is the rectum or the colon in general. And you can see this thing in front is basically the urinary bladder. Tamam. So 1 and 2 and 3. So once we see these three structures, we know that this is basically the female reproductive system. So as you can see in here, the urinary bladder, the uterus, and the colon. Okay. So what will they exactly ask in this thing? They might point into any structure. For example, let's say into this structure, and they will tell you what is this, for example, or what are, for example, the nerve or artery or vein or whatever that supplies it. Okay, so once you know that this structure is like this, whatever such questions they have, at least you will get more oriented to know the most correct answer. And you know what is this structure before. If you didn't know the structure, even like the sub questions might like you get it wrong. You get my point? So once you're oriented, so you're gonna like have the answers correct. So they want really, for example, ask you what is this structure or what is this or what is blah blah blah. So there's no need, for example, to get like distracted into other structures as long as you just know like the most important injury related structures. Okay. So let's have a very quick review. So in regard to number 22, as I said, this whole thing is the colon, and the very end part is the rectum. In regard to this thing, as we said, this is the uterus. Okay. And at the end of the uterus, we can see in here before the vagina, the long thing. Like this is the vagina. Before it, we have in here the cervix. So this is the uterus, this is the cervix, and this is the vagina. And as we said in here, we have this is number 10, basically the urinary bladder. And number 11 is going to also be the urethra. Okay, so those are the structures in regard to this section. Comparing it to this section, it's also a sagittal section. So we can see the first thing we can know is this is a sagittal section, and then we can see this is the lower part of the like of the pelvis, right? So just to get more oriented, this thing in here is gonna be the colon, and then this very end part is gonna be the rectum. Okay, what did we say? Number 10 is gonna be the urinary bladder. So once we see we only have rectum and urinary bladder, we will know that this is basically a male reproductive system. Plus, also if we see those external genitalia, it will also help us, for example, like the testis. It will also help us in knowing that this is the male reproductive organ, and whatever question we ask in here, also questions, we're gonna like get more oriented to what exactly is this. So let's just have a quick review. So as we said, this is the rectum, this is the testis. What about number 20? It's the, as we said, the testis has the segment vestibules, and then from here immediately behind it, it has the epididymis, right? So number 20 is going to be all the way to the epididymis. And then we have in here the number 32 is showing basically the penis. So this is just a penis. We have a continuation of the penis, because it doesn't show off. It's just like a sagittal section of the internal organ. So this is the like a sagittal section in general. So this is the penis, and this is the testis, as we said. Okay. So we have in here what else is important to know? So we have in here this number 27. It just says that it is the urogenital diaphragm. Okay. As we said, number 10 is the urinary bladder. So we can see here there's a connection between the urinary bladder all the way to the penis. Tamam. And you can see here the distance is very close to the penis. This can also like get you oriented that it is a male reproductive organ. Tamam, tamam. Okay, what else is important? So we can see in here, number 12 is basically the ejaculatory ducts, okay? And that's mainly it in this picture. So, just not to miss anything. Okay, so as you can see here, number 14 is the prostate gland. As we said, this is the urinary bladder. We have the urethra all the way through it, and immediately after the urinary bladder, the neck of it, immediately we're gonna have the prostate gland, right? And the left prostate gland, or the prostate lobes, okay? Here we have number 12 is the seminal vesicles. And I guess that's mainly it in this image. Okay, perfect. So, just to make sure, do you guys have any questions? Okay, perfect. So, moving on to the female reproductive organ, as you can see here, mashallah, we have a lot of things to identify. Okay, so the image seems to be a lot, like in here, but just let's get oriented generally speaking. So, starting off with the very middle structure we see. First of all, this is a like this section is basically a colonal section, this thing all the way in here. So let's get more oriented. As you can see in here, those are most probably the legs. This is the femur bone. As you can see, this is white thing in here. So this is the femur head. This is the femur bone. Same goes all the way over here. So خلاص, we know that this is a cross section. تمام? Perfect. So خلاص, if you're not really too much oriented to the like how the structures are exactly a cross section, like a sagittal section or a coronal section or whatever, you can look at any other structure like outside the thing you want, for example, like the femur, and it will help you in getting oriented where are you exactly in space. Tamam? So as you can see in here, number 10, what do you guys think is number 10? It is the, as we said previously, it is the urinary bladder, right? So this is the urinary bladder. This is the urethra, okay? We have in here some of the muscles, which is basically called as the obturator interns muscle. We have in here the right one and the left one. We also have in here the female genitalia. Just go more down to be clear. We have in here the female genitalia. As you can see here in number 15, it's the labia majora. And if you have the labia majora, we should also have the labia minora. Okay, perfect. As you can see here in number 2, we have the uterus. Okay, and we have in here the uterus. Of course, it's going to be connected to the fallopian tube, to the ovary. So you can see in here, this is the left ovary. And we have in here all the way the right ovary. So this is the uterus. We have in here 2 ovaries. So for example, if we pointed to this structure and you aren't sure what is this structure exactly, you can see exactly you have another one from here. Like the exact same structure of this is here. So far, you will know that this structure is most probably available in both sides, the right and the left side of the body. And since we are in the lower part of, for example, the abdomen or the lower or in the pelvis itself, so you will know that what is the structure that's available in both the left and the right side is the ovary. So you will know that this is most probably the ovary. So if you know this is the ovary, you will like guess more correctly. This is the uterus. This is the urinary bladder. Okay, so this is like another tip and trick to just get to know the correct answer by just identifying any other structure you might know, or by knowing if this structure is available in the left and right as well. It will what's the structure in the, for example, pelvis available bilaterally is the ovary in terms of the female reproductive system. Okay. Very good. So moving on to another image, this is almost exactly the same, but just another section of it. So as you can see in here, as we said, number 10 is going to be the urinary bladder. We have here the uterus, okay, and these are the legs. We have in here the right and the left leg. So moving on more, this is another section of the pelvic. The things that are available in the pelvis. So as you can see in here, what does this look like? As we did previously, it looks like the uterus. So as you can see, this is the uterus. At the end of it, we have the cervix. تمام. So this is the uterus, at the end we have the cervix, and then after that, after the cervix, we usually have the vagina. Okay. So we can see in here, this is the rectum. So this is the below or the posterior part, and this is all the way the anterior part. Okay. Perfect. As you can see here, number 6, basically the, as the previous is the ovary. So we have the uterus. Okay. So once you get, once you understand this image, like how things are arranged in this image, almost if they get any other section, even though the sections aren't like similar, you get oriented to where exactly you are, especially like if you practice your brain, and like by practice, inshallah, everything will be inshallah easier. Okay. So this is another section. We have number 10, and the previously is the urinary bladder. Behind the urinary bladder on the posterior side, we have this thing, which as we said is called the rectum. This is the rectum, and this is the urinary bladder. And we're gonna also have like whatever structure that's gonna be on the way in front. Okay. Okay, perfect. So this structure number 5, it's gonna be all the way the vagina. So the vagina, as we already know, in the female reproductive system, we have posteriorly the rectum, anteriorly the urethra, and in between them will be all the way the vagina. Okay, and we have here number 26 is basically the muscle, which is called as the operator internus muscle. Okay. Okay, perfect. So as you can see here, this section is showing the perineum, and this section is almost very similar to the cross section of the actual perineum that like the doctor showed in the slide. So once you see like this shape, it will all like your brain will all split to the shape that you like to figure that you saw like previously. So you will know that this is most probably the perineum, the exact same thing, yellow. So what do you guys think is number 11? So the first and the most anterior section is the urethra. تمام. So this is the urethra. What about number 28? It is the perineal body, exactly, just the perineum itself. So since we said this is the perineal area, so this is the perineal body. تمام. And in regards to the structure that's available in number 3, this is the anal canal. Okay. And of course we have the vagina somewhere in here. Okay. That's between all the way the urethra and between the rectum. تمام. And the first anterior structure that's available at the very beginning of the perineum in the female reproductive system is the, what do you guys think is this? It's the clitoris, right? So the first and the most important, the most anterior structure is basically the clitoris. Okay. Okay, moving on. Right. So since we talked a lot about the female reproductive system, female reproductive organ, now we're gonna all the way move to the male reproductive system. Okay, and personally for me, understanding the male reproductive system is way more easier than female. Okay, so this is just a fun fact about me actually. Okay, so moving on to the male reproductive system. So we have a section, mashallah, it has a lot of things. So let's get oriented one by one. So as we said previously, what is number 10? Number 10 is the urinary bladder. So as we can just to get oriented, this is the very most anterior part, and behind is the very most posterior part. So once they formed something into here, that means it's a structure that's available all the way to the anterior side. Okay, so this thing in here is basically the urinary bladder. If the urinary bladder is here for male reproductive system, this another opening will be the rectum, right? So we have a colon and it ends up all the way with the rectum, تمام? And as we can see in here, we have a couple of muscles that all the way support the the pelvis itself. So we have in regard to this muscle, as we said previously, is the operator internus muscle, and we have those are in the male reproductive organ, those are the seminal vesicles, and this is a cross section that's taken from a little bit from above, okay, not from the very below, okay, because of that it shows off the seminal vesicles. So as we said, this is the seminal vesicles, operator internus, the rectum, and the urinary bladder. Because now we're oriented to those structures in the male reproductive organ. So another section will be almost similar. This thing at the very end, at the very posterior, is the rectum, right? This muscle, as we said previously, is the operator internus muscle. So see, it's repeating itself, like all images, it's true, some of them are different orientation into the space, but see, I mean, the idea is almost the same in everyone, تمام? Okay, so this whitish structure is almost always a bone. So what's the bone that's, or bone or cartilage? So what's this thing that's available into the very most anterior of the pelvis is the pubic symphysis, تمام? So as I said, this is the anterior part, and at the very behind is the posterior part. So this number 22, as we said, is the rectum. This is the obturator internus muscle. Okay. We have also in here the number 13. This section is showing the an opening or a duct, which is called the ejaculatory duct. Okay. And we have in here all the way the urethra. The urethra. Okay. So this is it, I guess, in the image. And we have in here this circlish thing is basically the prostate that all the way encircles the urethra. Okay. So this is the prostate. Perfect. So moving on after finishing the anatomy, let's just have a gross images. So as you can see in here, to get oriented, this is basically showing the pelvis. As you can see in here, this is the pelvis. Okay, what's the anterior, what's the posterior? As you can see here, this is the back side. So this is the posterior and this is the anterior. Or another clue is basically the vertebra. As you can see in here, this is the vertebra. So this is the posterior side and this is the anterior side. Okay. So once you want to know what is this model exactly showing, a female or a male pelvic like organs. So female organ should have urinary bladder, the uterus, and the colon. Male should have urinary bladder and the colon. Okay. So once we see we have those three structures, the urinary bladder, the uterus, and the colon, that means now we are talking about the female reproductive organ. Tamam? So let's get just more oriented into those things. As you can see here, this is the vertebra and this is just the abdominal muscle, like any pinkish reddish color is basically the muscle. Okay, so let's get more oriented to those structures in here. So as we said, this is the urinary bladder. We said this is the uterus, and this black structure is basically the colon. Okay, so let's, for example, get to know what is number 11. So as you can see, this is the uterus. So what's this thing that comes all the way out of the uterus? It's the fallopian tube, and the fallopian tube is all the way connected to this one, which is the ovary, right? So we have in here the ovary, like the fallopian tube, and the ovary is like this, so it's all the way interconnected with one another. So this is the ovary. In regard to number 2, it shows of the vessels. We have the artery and the vein. So these are the external iliac vessels, okay, that come all the way from the common iliac vessels, because the common iliac vessels is split into the external and the internal iliac vessels. Okay, this is it. Can zoom out. We can see in here, as we said, the common iliac vessel, which is number 4. We all the way give branches to the external and all the way to the internal iliac vessels. Why is it called external iliac vessels? Because as you can see, it gives supply all the way to the external structures, like it's going all the way externally outside, compared all the way to the internal iliac vessels, which gives supply all the way to the internal structures all the way in here. Okay, so this is it in regard to this thing in here. And okay, so what about number 15? What do you guys think of number 15? So we said this is basically the uterus. So the uterus will end up here with a cervix, and then after that we have this long thing. It's going to be all the way the vagina. Okay. So this is generally if we have in here the vessels, we have the muscle, we have the organs. Okay, let's talk more about the very last end area, this area, the perineum. So what is number 20? Number 20 is basically the thing that holds all the way those things. So the thing that holds the diaphragm. So it's called the pelvic diaphragm. So number 20 is the pelvic diaphragm. Okay. We have in here another diaphragm, which is the urogenital diaphragm. And we have in regards to number 21, it's basically the end of the rectum, which is the sphincter. And it's called the anal sphincter. Okay. And in regards to the number 22, as we said, we have the labia majora and the labia minora. And the very first part of the after the mons pubis, we have in here the clitoris. Okay, so this is just a very brief, hopefully, orientation of the female reproductive organs in this cross image. So once you know this thing, if they got you any image, so anatomage or any other thing, you must probably know it. How will the question come in the OSPE? They can point in any structure, let's say as a fallopian tube, as I said previously, and they might ask you what are the cells that are available in the fallopian tube. You'll say مثلا polar ciliated and non-ciliated cuboidal. For example, they might point in the ovary and they will tell you, for example, 1, 2, 3. Once you're oriented to this and really confident of your knowledge and you know where you are exactly, any other sub question they will ask, inshallah you will get it correct as long as you know where are you exactly in space. Okay, so when they got you, for example, they ask about the fallopian tube in this cross section. or this sagittal section. Or if they ask, for example, about the fallopian tube in the, let's say, any other section, خلاص, you will exactly know what shall be the correct answer. Okay. So this is, as we said, this is just this is the uterus. If you want to zoom in all the way to the uterus, as you can see in here, and normally the uterus should lie above the urinary bladder. As you said, this is the urinary bladder. Normally it should be in this position. If the uterus is in any other position, this is not normal. Okay, so we usually like return the uterus to its original place. Okay, and another extra knowledge to give is that those are the pelvic floor muscles and the diaphragm. So if we have any weakness in those pelvic floor muscle, we can have prolapse of any organ, so of the uterus, the vagina, of anything, even the rectum. Any organ can all the way prolapse if we have weakness in those muscles. Because of that, there is an exercise which is called, one of the like most common exercises. It's called Kegel exercise. They usually train those exercises are mainly for the pelvic floor muscles to strengthen those pelvic floor muscles. Okay, and actually some female undergo surgeries to strengthen or to pull all the way the pelvic floor muscles, especially if there was a prolapse. So it's like, so yeah, this is why they are really quite important, just to know the other side of it, just to make it quite interesting. Okay, so as I said, this is the uterus, and then we zoomed in. This is the uterus, zoom in. So we can see in here those three white structures. What are those structures? We can see this number 1, number 2, and number 3. So the first structure here, which is number 12, it's basically the round ligament. Round ligament of what? It's the round ligament of the uterus. In regards to number 11, it's basically where the fallopian tube all the way goes and ends up with fimbria to all the way be connected with the ovary. And in regards to number 10, it's all the way the ovarian ligament. So we have 1 and 2 and 3. This is the ovarian ligament, and this is the round ligament, number 12, and number 10 is the ovarian ligament. And in between them, which is number 11, is basically the fallopian tube. Okay, so moving on to this structure. As I said previously, this structure, they just opened all the way the things, like what's inside, compared to this thing in here. So here everything is closed. Once we all the way open them, this is how they exactly look like, which is the exact same thing. We'll just have a very quick video. So as we said, this is the common iliac vessel. It's going to all the way split to this thing and this thing. This is the external iliac vessel, and this is the internal iliac vessel. Since we see, generally speaking, from outside, like the general image, this is the anterior part, this is the posterior part, because we have the vertebra, it's all the way at the back. We have in here, this is the urinary bladder, this is the uterus, and this is the colon. And those are the openings of 3 of them. So this is a female reproductive organ, like organs. So as we can see in here, the uterus is all the way connected to the fallopian tube, which has the ovary. We have in here, this is the urinary bladder, and this is the urethra. We have in here, those are the structures of the perineum. We have in here, this is the uterus. We have in here, number 14, as I said previously, is the cervix. After the cervix, we have this very long structure, which is all the way called the vagina. Okay. And what else we can point? So basically, we have in here, just zoom in. We have in here those 2 openings. This is the first opening, and this is the second opening. So if we have this opening is more to the anterior part compared to this opening, which is more to the posterior part. So this opening is called the anterior fornix, and this opening is called the posterior fornix. Just to make it more to clinical aspect, basically, once they want to take a vaginal swab, for example, for whatever pathology, or for routine checkup, they usually go all the way from the swab to the vagina, and then they take it. It's better actually to take it from the posterior fornix. Why? Because the posterior fornix, as you can see, compared to the anterior fornix, it's deeper, and it's like deeper and darker. So usually more organisms, if an organism want to grow, it usually grows more into the posterior aspect because it's all the way deeper than the anterior fornix. Okay, so this is just to have a clinical aspect, because I honestly feel if we have a clinical aspect or what is exactly like used clinically, it's gonna make it more fun. Plus, it's gonna make it easier to memorize than just memorizing this is blah 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 blah. So this is basically the fact behind the posterior fornix. The vaginal swab is better taken from the posterior fornix because it's deeper and it's where more organisms are actually available compared to the anterior fornix. Okay, tamam. So this is it, I guess, in this slide. I hope I missed nothing. So moving next. This is just number 21, which just basically points on the anal sphincter. As we can see, this is basically the colon, this is the rectum, and in here we have the anal sphincter from this side as well, all the way from this side. Okay, perfect. And this is the anal canal at the end. So if this is the anal canal, this is the anal sphincter and the anal sphincter. Okay, perfect. So looking onto this thing again, so we should orient ourselves. As we said, anything that's whitish in color, it's either a cartilage, it's most probably either a cartilage or a bone. So as you can see, this is the pubic symphysis. So now we know that this is the anterior part, and this is all the way the posterior part. So we can see three things in here: the urinary bladder, we can see the uterus, and we can see the colon or the rectum, and the anus at the end. So the exact same thing is repeated. So this is the pubic symphysis, this is the urinary bladder, this is the uterus, this is the cervix, this is the vagina, anterior and posterior fornix of the cervix, right? So this is, as we said, this is the rectum, this is the anus. These two things are the anal sphincter. Okay. So what else to mention in this image? So basically here they just mentioned a pouch, and this pouch is quite important. We have in here 9A as well as the 9B. So this is the 9A and this is the 9B. Both of them are basically pouches. So anterior to the uterus and posterior to the uterus, we have pouches. In regards to 9A, we have the uterovesical pouch. So utero, from the word uterus. So uterovesical, vesicle, which is the urinary vesicle or the urinary bladder. So uterovesical pouch, it's this one in here. If we have pouch in here, we also have pouch all the way posterior to the uterus. This is called the recto-uterine pouch. Why is it recto? Because the rectum is all the way here, and the uterus is here, so it's recto-uterine pouch. So you have pouch all the way in here, and pouch all the way in here. One of the fun facts actually about the recto-uterine pouch is that sometimes the surgeons might use it, or they will use it in basically doing a removing the gallstones during a cholecystectomy. Okay, so what they do is that they enter all the way from the vagina, and then they reach to this posterior part, which is the recto-uterine, and then they go all the way to the abdomen till they reach the gallbladder, and then they, for example, either remove the stones, either they do complete gallbladder removal, which is called as the cholecystectomy. And why do they are basically anticipating to use this thing to prevent any surgical scar of the abdomen, and to have very basically if they entered all the way from here, the patient might remove the whole gallbladder or the stones or whatever without having any scar like externally, so from the vagina or even from the abdomen. So this is actually one of the facts why the recto-uterine pouch is is quite significant. Okay, so this is another clinical aspect just to make it more more entertainable, hopefully. Okay, so we have in here the exact same thing, but it's actually from another angle, which is from the above. Okay, so we can see in here number 1, number 2, and number 3. So we have 3 structures. If we have 3 structures, it's most probably talking about the female reproductive organ. Okay, so we have in here this structure, as we said, the very posterior part is the rectum. We have in here, this is the uterus. This very big thing is the uterus from up. And we have in here, number 7 is basically the urinary bladder. Also, those 3 structures are orientation from up. Okay, so we have in here the number 18 bilaterally from this side, and also from this side is basically the round ligament of the uterus. As we can see, this is the uterus, and this is the whole thing. It's basically the round ligament of the uterus. We have in here number 10, as we said previously, this is basically the ovarian ligament. Okay, number 11, this one, as you can see, this is the uterus, and this is the fallopian tube bilaterally, going all the way from it. At the end of the fallopian tube, we have the fimbriae, and here in regards to number 8, we have the ovary. So the fallopian tube has fimbriae, and this fimbriae all the way attached to the ovary. Okay, so this is it in regard to this picture. Okay, so we said number 18 and number 12, just to repeat it. So number 12, عشان not to mix it. So we have in here, this is the uterus, and this is a thing that comes all the way from the uterus. This tube, as we said, is the fallopian tube. In regard to number 12, it is the round ligament of the uterus. In regards to number 18, it's the broad ligament of the uterus. How to differentiate it a bit is that once you see something really so wide from this side and from this side, like it's really so wide, or in other words, it's really so broad, so it's the broad ligament of the uterus, compared to number 12, which is the round ligament of the uterus. Okay, so moving on to this image. As we said, we already discussed this image before, which is the female reproductive organ. We have 3 structures: the urinary bladder, the uterus and the colon and the rectum and the anus. Okay, and now we're going to talk more about the male reproductive organ, which is basically this thing, as we can see in here. Once we see, for example, this structure all the way, we will know that this is the anterior part, and this is all the way the posterior part. How will we know this is the anterior part? From the male genitalia, and posteriorly, as you can see, because we have the vertebra that's all the way available from the posterior side. Okay, so let's get more oriented to the male reproductive organ. So we have in here, this is, as we said, the abdominal muscle. We have in here, this is the pubic symphysis. So this is the urinary bladder, and we can see this is the urethra, and then all the way continuous to go all the way through the penile or the penis. And then we have in here, this is the back is basically the colon that all the way ends with the rectum and the anus. Okay, so we have in here, this is the urinary bladder. This thing that comes all the way from the urinary bladder is going to basically be the urethra. And as we said in the male, we have the thing that's available, the structure that's available at the neck of the urinary bladder is basically the prostate. We have in here the prostate. Okay, so let's get more oriented to the male reproductive organ. So we have in here those basically all structures of the male and of the female are all the way named into those things. The mother, we have the male mother as well as we have the female mother. Just to compare both of them together, of the male mother and of the female mother. So as we said, the male is going to have two openings, which is the anal opening and the urethral opening. Compared to the female, they will have usually three openings. We have the vaginal opening, the urethral opening, and the anal opening. This is the first thing. In regard to the abdominal muscles, the pelvic muscles, they are almost equally both for the males and for the females. For the male, they of course have the testes, they have the seminifertilios, they have the penis, they have the prostate, and as we said, the prostate is all the way available at the end of the or at the neck of the urinary bladder or the beginning of the urethra. We also have the gland penis. We have the epididymis, and as we said, one of the important things that might come is basically the pampiniform plexus. And this plexus basically have arteries, have veins. Okay. Else we have the pelvic diaphragm. We have the almost exact muscles in the female and the male. Okay, so that's mainly it in regard to this picture. So moving more to the perineum, as we said previously, we have this picture. So basically, just to orient, this picture is first, we have this picture basically shows a female or a male genitalia. As you can see in here, we have the three openings, and those three openings, once we have them, cross the length, then we're talking 1 and 2 and 3, then we're talking about the female reproductive organ, right? So this, as you can see, is the pelvis, and this is basically showing the perineum. Okay, so as I said, the first very anterior structure is basically the clitoris of the female reproductive organ, and then we have in here, this is the first opening is the urethra, and then we have the vagina, and at the very end we have all the way the rectum. Okay, so everything in pink or purplish color is basically the muscles. So let's get more oriented to them. So as we said, this thing all the way in here, the encircles in this way, is basically the labia minora. And if we have, as we said, labia minora, we also have the labia majora. Come on. Okay, so in regards to number 44, this thing in here, it's basically a gland, which is called the Bartholomew gland. And this gland is one of the glands that help in the secretion of fluids and help the place to be all the way humidified. Okay, so we have many glands in the perineum of the female, and all of those things help in the aid of having a humid area instead of having a dry area. Okay, and actually one of the things that post-menopausal women will have is that after like the menstrual period won't come to them, like post-menopause, is that they will have one of the very most common symptoms is that they will have vaginal dryness. And because, as we said, because the glands and everything won't really secrete as it used before. One of the reasons, other than aging, is that the hormones actually won't really be active as they were active during the menstrual cycle and everything. So this is why actually it's quite important to have a humidified area, because dryness is gonna be quite painful and it's gonna be bad in general. Okay, so yeah. So this is in regard to the clinical aspect of the glands of the perineum. We have number 42. It's basically the bulbous spongium muscle. As we said, everything and think about purplish color is muscles. So I'll just pass through them quite quickly. We have in regards to number 1 is the perineal membrane. We have in regards to number 39 is the superficial transverse perineal muscle. So any perineal muscle, most of them will actually have the word perineum in them because they are available in the perineum. So as they said, it's a مسمى. So yeah. So what else we should know here? Okay, so we have in regards to number 30. Number 36, as we said, it's gonna basically be the anal orifice in regards to this thing that's connecting the anterior part with the posterior part, which is number 35. It's basically the perineal body that connects the urinary, the urethra and the vagina all the way to the rectum. Okay, so this is the perineal body. And I guess we mentioned everything in this picture. In regards to number 40, we said it. Yeah, I guess that's it. Okay, perfect. Just for the sake of mentioning, we have in regards to number 43, it's the ischial cavernous muscle, which all the way comes like this, bilaterally from this side as well as all the way from this side. Okay, why is it called ischial? Because it's connected all the way to the ischium, which is the ischium bone, and like ischial cavernous muscle. Okay, so this is like why it's named ischium at the beginning. Tamam? Okay, perfect. So this is exactly almost the same, but it's like another view. Okay, so this is the inferior view, as we said. In here, we basically have the perineum all the way from the, this is basically the perineum. We have just to get oriented. This is basically the posterior part, and this is the anterior part. Okay, how will we know that this is the posterior part? First, you can know from the orientation of the bone itself, of the pelvic bone itself. And number two, you can get to know it is that you can see this is the pubic symphysis at the very beginning. Plus, we can see in here the rectum at the beginning, at the like behind, and the vagina and the urethra is all the way like at the front. Okay, so it's almost exactly the same. Here they are basically just zooming in the structures that are available in here, which are number 45. Just to zoom in more, we have in here the pudendal canal. This is that's available all the way in here. And this pudendal canal basically carries the arteries, it carries veins, and also carries the nerves, the pudendal artery, vein, and nerve. Okay, so this is almost exactly the same. We have in here the clitoris, we have in here the urethra, the vagina, we have this the perineal body, and this is the rectum, and these are all the muscles that are all the way encircling the pelvic floor. Okay. One external thing to add is that we have in here number 21. It's basically the external anal sphincter. So this is the rectum, and this circle that all the way encircles it is the external anal sphincter. This thing that's number 1 is basically coming from a bone, which is the coccygeal bone. As I said, this is the posterior part, and this is all the way the anterior part. Okay. We also have in this picture the obturator internus muscle. This is another like orientation of the obturator internus muscle. Okay, so we can see it all the way in here, and I guess that's mainly it from here. And as we said, this is the gland, which is called all the way as the greater vestibular gland, or in other words, we have the Barthonian gland, this whitish thing. Okay, and it's also available bilaterally from this side, and also it's available from this side. Okay, but here it's basically covered with the bulbous spongiosum muscle, with this number 42. It's the bulbous spongiosum muscle that basically covers this gland, which is the bulbous gland. Okay, very perfect. Which is the Barthonian gland. Okay, perfect. So moving on to this image, it's almost exactly the same. We have in here the female reproductive organ. How will we know it's the female? Because we have in here 3 structures, 1, 2, 3, the urinary bladder, the uterus, and the colon. The same thing we have in here. This is anterior, this is posterior. How will we know? Because the urinary bladder is the most anterior compared to the rectum and the colon, which is the most posterior. Number 1. Plus number 2, we have the pubic symphysis. It's always available in the most anterior compared to the compared, for example, to the vertebra, which is available all the way in the most posterior. Okay, so exact same thing. This is the uterus, this is the cervix, this is the vagina, this is the colon, this is the anus, this is the rectum, this is the colon, the whole colon. At the end, you have the rectum and the anus. Those are the anal sphincters. We have in here, this is the perineum, and let's mention. Okay, we have in here the urogenital diaphragm, number 32, as we said. All those things help in lifting the pelvic muscles in general. What else? We have in here, this is the external sphincter, as we said. We have number 26 is the anal canal. We have number 27 is basically the internal anal sphincter. So as we already know, if we have any external, we should have internal and vice versa. So if this is the internal anal sphincter, we should also have the external anal sphincter. Okay, so I guess I almost mentioned everything. Number 35 is the perineal body, as we said previously. The thing that connects the urethra and the vagina all the way to the rectum is this thing, which is all the way known as the perineal body. Okay, and here we have, this is the diaphragm. Number 32 all the way goes like this, the urethral diaphragm. And I guess that's mainly it in this line. The same goes to the urethra. We should also have sphincters that hold, for example, the urine to prevent any incontinence. So we have in here this number 33 is basically the external urethral sphincter. And I guess that's almost everything in this picture. Okay, so just now, you guys have any questions before moving further? Okay, no questions. Perfect. Okay, moving on. Okay, so this image is all the way from up. So this shows basically the male genitalia. We have in here this one, and this one. So basically, this is the rectum, and this is all the way the urinary bladder. Okay, so let's get more oriented to it. So we have in here number one is basically the rectum, right? We have in here those two images. Number two, so basically, first of all, this shows like a couple of images together. Okay, just together, not to confuse it. So we have number one, as we said, this one is the rectum. Okay, we have in here those two structures that all the way go away is basically the this is basically number three is the peritoneal layer. We have in here number four is the urinary bladder. This picture actually has a couple of things together. Number 10, as we said, this is the penis. And number 11 is the gland penis. Gland penis is at the end of the penis. We have number 12 is basically the charismatic muscles. And طبعا all these structures are only available in the male and they are not available in the female. Okay. So okay, so we have in here those two images. As we said, this one and this one, those are the vas deferens, or the ductus deferens, if you want another name of it. Okay. Okay, I guess that's mainly it in this image. We have this one, the vas deferens, and this is also the vas deferens. Okay, so I guess there's a mistake in the naming in here. This, as you said, this is the rectum, and this is basically the penis, and those are the male external genitalia. We have in here number 7 is the pantanoform plexus, that have basically arteries and everything. And yeah, this is the penis, and number 11 is basically the last penis. There's a mistake here in the naming, so you just get oriented to what you actually understand. Okay. Okay, perfect. So this is another view, which is a frontal view or a side view of the male organs. So how we pronounce the male organ, as you can see clearly. So this is the anterior part, and this is the posterior part. We have number 1 is basically the rectum, as you can see all the way in here. We have in here, these are the vas deferens. We have in here, this is the testicles. We have in here, this is the penis. This is the glans penis, which is all the way at like a very bottom part of the penis. We have in here these things all the way from the back. It's going to be all the way the epididymis. Okay, and we have the small structure is the testis. We have in here the just to look in the pantaniform plexus. As you said, the plexus that have arteries and veins. Okay. So we have in here the muscle, number 14, which is basically the obturator internus muscle. If you have obturator internus or internus, we also should have the externus. So we have in here, this is the obturator externus muscle. We have in here the urinary bladder, as I said previously. Okay. And I guess that's mainly it in this picture. So we have in here the seminal vesicles, which is all the way number 18. This is the seminal vesicles. Okay. And just for the sake of mentioning, we have number 19 is basically the prostate gland. How is the prostate gland? We have in here, this is the urinary bladder. After the urinary bladder, at the urethra or the urinary bladder neck, we have immediately the prostate is attached to it, okay? And then the urethra runs all the way till it goes all the way outside, okay? So yeah, and the sac at the very behind of the testis, this thing is all the way called as the sputum, or it's called all the way as the scrotal sac, okay? Good. So moving on, this is another orientation of the male, like male genitalia, external genitalia. We have in here this picture all the way in here and also all the way in here. It's almost exactly the same. So this image is just without removing the like half of the penis, and here when they basically just did a cross section and remove like half of the penis. Okay, so just to get oriented, this is basically, as we said, the male genitalia. So this is the number 10 is basically the penis and or the body of the penis, and number 11 is the end of the penis, which as we said is the gland penis. Okay, so we have in here number 12 is going to be all the way the cremasteric muscles. Bilaterally, we have here and here the cremasteric muscles, and we have in regards to number 7, as we said previously, it's basically the pampiniform plexus that has the veins, the arteries. Number 9 is going to be all the way the testis. As we said, we have testis bilaterally from this side and also from this side. And here we have, after the testis, we have the epididymis, and everything is going to be covered by the scrotal sac. Okay, so in regard to this image, it's basically after we remove half of the penis or the body of the penis, we basically can see this thing. So in regard to this thing in here, we have in here this thing all the way. It's called the crest of the penis. We have in here this thing and this thing. The first thing is called basically the spondylourethra, and after that we have the bulb of the penis, okay? And all those namings are only available in the male genitalia, of course, not in the female genitalia, okay? So in regard to the naming, usually they will get, for example, like they pinpoint to a structure in here, and they might ask, for example, what's the name of the structure, maybe what pathology can happen, or they might, for example, give a histology picture, for example, of the seminiferous tubule or the vas deferens or whatever, and they will tell you, for example, they might ask any other sub questions of, for example, this histological picture. Okay. So this is another section. As you can see, this is the posterior part, and this is the anterior part. This is the penis, as you can see, and at the behind we have the rectum. So this is the urinary bladder. After it, we have at the urinary, at the urinary bladder neck, or at the beginning of the urethra, we have the prostate. And then this is the urethra and all the way goes to the very outside. So this is the penis or the penile body, and this is the glans penis. Okay, so this is the testis, as we said already previously, and this is the scrotum, and this is the intrascrotal pouch. Okay. Okay, so or the intrascrotal septum. We have, but just to get more oriented, we have this is the rectum, and then after that we have in here, this is going to be all the way the anus. Okay, we have in here the external and the internal anal sphincters. So in regard to this thing in here, number 34, it's basically the ejaculatory duct. As you can see, it's going to all the way pass through the prostate itself. We have in here number 26 is basically the urethra or the pre-prostatic urethra. Then we have urethra, it's pre-prostate and it's post-prostate, and it's in the prostate, like passing through the prostate itself. So this is the pre, which is before or behind the prostatic urethra. Okay. And what else? As we said, number 19 is going to be all the way the prostate, and number 27 is going to be the prostatic urethra. So that's mainly it in this image. Number 23 is the spongy urethra, and we have number 24 is the bulb of the penis, as you can see in here. This is the bulb of the penis from below and also from the above. And of course, this whitish thing, as you said, is going to either be a bone or a cartilage, and this is a pubic symphysis. Okay, so moving on to this image, it's almost exactly as I said previously. This is just a sagittal section of the male reproductive organ. This is the anterior and this is the posterior part. Let's just get oriented very fast. This is the penile, this is the glans penis. We have in here, this is going to be the testis, and this is going to be the epididymis. That's going to all the way go all the way to above. We have in here number 2 the vessels, which are the iliac vessels, and regard to number 2 is the external iliac vessel. We have in here, this is the urinary bladder. Okay, you can see in here a part of the colon, which is the sigmoid colon, like it's a cross section of the sigmoid colon. We have in here, this is going to be all the way the bone, number 22. which is the sacral bone, like the vertebra. And we have in here the vessels, as we said, the common iliac vessel, that's respect to the external and the internal iliac vessel. Okay. So that's if you look at this image. As we said in here, number 8 is the prostate, because immediately after the urinary bladder, in the males at the neck of the urethra of the urinary bladder, we're gonna have immediately the prostate. So if you just understood like the general concept, inshallah, whatever picture you guys will have, it will be like easy to orient yourself. Okay. We have also in here number 12 is basically the sternal vesicles, and yeah, that's it. Okay, perfect. So in regard to this image, it's almost exactly the same. As we said, this is the urinary bladder, and this is the penis. We have in here, this is the testis, and this is the part of the colon. Like it's almost the exact same image as we explained. Okay, so moving on further, this is almost exactly the same, because it's only a sagittal view, or in other words, it's from the lateral side, a lateral view. Okay, so we have in here, this is the muscle. Anything think purplish is basically the muscle. We have in here the abdominal muscles, and we can see in here, as you can see, this is the anterior part, and this is the posterior part. This is anteriorly because of the male genitalia, and posteriorly because of the vertebra. So we have in here, this thing basically is the urinary bladder, and you can see the ureters that all the way come from the kidney to the ureter to the all the way urinary bladder. So this is the ureter. Okay, so just be careful between the words of the ureter and the uterus, because like it might, like when you look at them, it might look the same, but yeah, of course, there's a very big difference between them. So this is number 3 is the ureter. Okay. We also have in here, as we said, the common iliac vessels that transmit to the external and the internal iliac vessels. We have in here part of the colon, as we said previously, it's the sigmoid colon. This is the bone all the way in here, which is the sacral bone. Those everything are muscles at the behind. It's of course we call the gluteal muscle or the gluteus. We have in here some of the pelvic muscle floors, the pelvic floor muscles. Okay. What else? So number 20 is going to be basically called the pelvic diaphragm. Number 19, as we said, is going to be the rectum, which is the very last part of the colon. Okay. So moving on further, we have in here the pituitary gland. So this is an anatomy of the head. How will we know? As you can see, we can see here there's the nose. So there's here a brain. So we will, and there's also cerebellum. Okay, so we will know that this is talking about the head. Okay, so let's get more to know, since like in the rip was gonna focus more on the endocrine glands in the head more than the brain, cerebellum, or anything else. Okay, so as you can see in here very clearly, number 1 and number 2, those are basically the pituitary gland. And as you know, the pituitary gland has both anterior and posterior lobe. So the anterior part, which is more to the anterior side of the face, or the head, is going to be the anterior lobe of the pituitary gland, and this is vice versa, the posterior lobe of the pituitary gland. As you know, anterior and posterior pituitary gland, both of them produce different type of hormones. Okay, and another name for the posterior pituitary gland is basically the neurohypophysis. Okay, so this is the pituitary gland, and it's all the way located under the hypothalamus. So as you can see here, number 4 is basically the hypothalamus, and number 1 and 2 are basically the pituitary glands. Okay, so this is the cerebellum. As we said, this whole brain thing is the cerebellum, and this is the cerebellum. This whitish thing, or the whitish fiber, is basically called the corpus callosum. So it runs like a fibrous anteriorly and posteriorly, like this. So this is known as the corpus callosum. Okay, so for number 7, this is the sphenoid sinus. So it's a sinus because it's an empty space, right? And what else we should mention here? And this is the sphenoid bone. Okay, so usually structures that are approximate to one another are almost named that like similar names. Okay, so like sphenoid sinus and sphenoid bone. Now, moving on to the next image, as you can see in here, this to get oriented, we have in here this is the face, and this is like the neck. So it's something in regards to the neck. So it's going to talk about the thyroid gland. So we have in here, this is the vertebra, as you can see, and this is somewhere in the neck. Like to get more oriented, for example, we have in here different numbers and different like shapes. So as we said, the posterior part is basically the vertebra. Okay, so this is the vertebral body, And then we have all the way in here, number 17, this is the thyroid cartilage. How do I know that this is a cartilage? We said anything that's whitish in color is either a cartilage or a bone. Okay, since it's in the neck, that means it's a thyroid cartilage, or it's basically part of the thyroid cartilage. Okay, so number 21 is basically the trachea. As you can see here, those whitish things are the cartilages, or in other words, the tracheal cartilages. Okay, so number 20 is the tracheal cartilage, tracheal cartilage, tracheal cartilage, and immediately behind the tracheal cartilage, we have the trachea itself. Okay, so this is it in regards to this picture. What else to mention? We have number 28 is basically the hyoid bone, and the hyoid bone is basically just all the way hanged up. Okay, we have in here, this is another image of the thyroid gland. Okay, so we have in regards to the number 23, it's basically the thyroid gland. As we said, to get oriented, this is the head, and this is the neck. This is like the head, the mouth, and this is the neck. So in the neck, of course, we predict to have the thyroid gland, and this is the thyroid cartilage. So immediately below the thyroid cartilage, we have all the way the thyroid gland. You can see this is the whole thyroid gland. Okay, and behind, of course, so this is the vertebra. As you can see, the bones. Okay, so this is all the vertebra or the vertebral body. So moving on to here, we have in here the cavernous sinus. As you can see in here, number 1 is basically the pituitary gland, and number 9 is basically the oblique chiasm. As we said, oblique chiasm is always in front of the pituitary gland. We have in regards to those things, number 11, the many branches are basically the cranial nerve branches. Okay, some of them are actually available all the way in here. Number 3, 4, 5, and number 6. Okay, cranial nerve. We have in regards to number 7, it's going to be the sphenoid sinus because it's empty, so it's called a sinus. Okay, and as I said, if this is the sphenoid sinus, this is all the way the sphenoid bone. Okay, so this is another cross-sectional image, as you can see, of the brain. As you can see, behind is the cerebellum, and those are the two lobes of the brain. So we can see in regards to number 1 and number 2, they are basically showing the pituitary gland, and the exact same orientation again. Number 8 is the some of the optic nerve. We have the right and the left optic nerve, and we have in regards to number 13 the cavernous sinus in here and in here. That's all the way surrounding the like from the right and the left side of the pituitary gland. Okay, so this is another section of the thyroid gland. As you can see here, in regards to number 21, it's basically the trachea, and as you can see here, this is basically the tracheal ring. Okay, number 20 is basically the tracheal ring. Come on. Number 23, as you can see, the thing that encircles all the way the trachea is going to be the thyroid gland. As we know, this is, for example, the trachea. The thyroid gland is going to all the way encircle it, like from anteriorly and from the lateral side. This is why we have the right thyroid gland, the thyroid lobe, and the left thyroid lobe, and in between them is basically going to be the isthmus. So number 24 is basically the thyroid isthmus, and in regard to number 23 is the right and the left right and left thyroid gland, okay, or thyroid lobes. This is the exact same picture you have in here. As we said, we're repeating everything. Number 17 is basically the thyroid cartilage because it's white in color, and number 23 is the, as I said previously, is the thyroid gland available. It's basically encircling the thyroid, it's encircling the tracheal cartilage. This is the exact same thing. Number 23 is the thyroid gland from the right side, and from the left side, here we have number 21 is the trachea, and this whitish thing is the tracheal cartilage. So this is almost exactly the same thing. Number 21 is the trachea, number 21 is the trachea, and number 20 is the tracheal cartilage. The same thing, this is the trachea, encircling it, number 23 is going to be all the way the thyroid gland from the right and also from the left side. What else? So this is just a bit more oriented. This is the anterior part, and this is all the way the posterior part. Okay, so I guess that's the very end of this session. I hope you guys inshallah enjoyed. I hope you guys inshallah benefited. If you guys have any question, I'm always more than happy to help. I hope it just give a sense, just a mini sense of like what are the most important things to focus on. I hope the tips and tricks inshallah helped out, and like what are the most important things to focus on. As we said, since this is an endoreproductive block, so try to focus more on the endoreproductive related structures more than anything else. so that يعني خلاص إن شاء الله you get to master it really so well and it won't really take much of time for you to really think during the OSCE time إن شاء الله. And of course I'm more than happy to help anytime if you have any questions سواء OSCE or anything else. Of course I'm always your sister and I'm always here more than happy to help. إن شاء الله all the best of luck in Endocrine and your like medical school life إن شاء الله. And yeah, that's it. If you guys would like to just scan this to have any feedback, I'm more than happy, of course. And thank you so much. Have a great day and Ramadan Kareem. Thank you.